So your healthcare provider ordered a urodynamics test. What is a urodynamics test? What is it used for? And what to expect when you're having a urodynamics test? Urodynamics is well tolerated and has few risks. The urodynamics test measures the function of the lower urinary tract system. The lower urinary tract system includes the bladder, which stores the urine, and the urethra, which is the tube that the urine travels through. How does the lower urinary tract system work? The kidneys make the urine, and the urine travels down the ureters and gets stored in the bladder until a socially appropriate time to empty the bladder through the urethra into the toilet. The bladder has two functions: to store urine and to expel urine through the urethra. Why would my provider have ordered a urodynamics test? Sometimes in discussing your urinary symptoms with your urologist, the answer to the problem is not clear. Sometimes symptoms are vague, or sometimes two things could be going on. Before a urologist wants to do more invasive procedures or recommend surgery, he or she wants to know what exactly is the function of the bladder in the disease process. I talk to patients about how the urodynamics test is kind of like an EKG of the heart. You go into your cardiologist and you say, my heart feels like it's fluttering or skipping a beat. The story doesn't always match up with what the actual function of the heart is doing. In the same sense, that's what a urodynamics test does. If a patient's symptoms are not clear or they're vague or multiple reasons could be the answer, the urodynamics actually takes a look at the function and the muscle and the emptying of the bladder in order to answer a question. And sometimes the question is what's going on with the bladder. Sometimes the question is surgery appropriate, or is watchful waiting or medication more appropriate? Urodynamics helps answer specific questions such as, is my bladder emptying all the way? Does my bladder have function? What is the reason for my bladder leakage? Why do I have a weak or intermittent stream? Why am I still having problems after I've previously had a surgery? Why am I getting frequent urinary tract infection? What should you expect when you come in for a urodynamics? It's good to come with a medium full bladder, not so that you're uncomfortable, so that you have some urine to try to expel for the beginning of the test. The beginning of the test is usually just voiding into a measured cup, which measures both the speed of the flow as well as how well you emptied afterwards. How well you emptied afterwards will be measured by putting in a catheter to measure a post-void residual. This first test, when you come in with your moderately full bladder and we measure the speed and the flow of the urine, is called a Uroflow Study. So the next step is a catheter going into your bladder, which measures how well you emptied, or a post-void residual. This catheter is a very specialized catheter that has pressure sensors and can allow urine to both go out and sterile fluid to go back in your bladder and fill your bladder. The next step is placing a catheter outside of the bladder to measure the intra-abdominal pressure, and this is done with a very small tube through the rectum, vagina, or sometimes an ostomy. This is a pressure sensor catheter and has no other purpose and is very temporary. The measurement of the bladder is called a cystometrogram. As the bladder fills, different pressure measurements are being recorded. The nurse doing the study is going to wonder about your sensations with filling, and that's why the test is very interactive. If one of your symptoms is bladder leakage, we will try to reproduce the leak either with cough or Valsalva while you are here, because we want to capture the condition for which you've come in to see the specialist. Small sticky pads are placed on either side of your bottom to measure your external sphincter activity, both during filling and urination. This is called an electromyogram. Filling your bladder should not hurt. When you feel your bladder is full, you will then be asked to empty your bladder into a small commode. This time you will urinate with the tubes in place. The reason is the tubes will measure your bladder pressure and to see how your bladder is actually functioning while you're emptying. The tube in your bladder is a special kind of tube that will let urine come out of it. This lets us look at your bladder function as it tries to empty. This is called a voiding pressure study, or a pressure flow study. After you've emptied your bladder, all of the tubes will be removed and you're allowed to leave. There are no special instructions after you've had a urodynamics test. It's normal to possibly feel a little irritated when you urinate for the day of your study, but this should clear up. And if it doesn't, I encourage you to call our office or a healthcare provider to be checked for infection, which is very rare. If you're able to come in with a moderately full bladder and have ease with bladder filling, and then we're able to get a good emptying of your bladder and reproduce any symptoms for which you started seeing your urologist for, this test should take no longer than approximately 30 minutes. I empower you to understand the reason that your provider ordered a urodynamics test. Understanding the reason behind tests and the questions they're supposed to answer helps people become much more comfortable with healthcare recommendations. We hope that this video and you understanding the questions that are trying to be answered with the urodynamics test will help you not be too embarrassed and understand we are professionals. We take our jobs very seriously and really hope to help you answer the questions so that you get the best treatment, the optimal treatment, and the safest treatment for your condition. Thank you.